Good morning, everyone. I'm Kimberly Chalia with PHCA. Thanks so much for joining us for today's webinar. A few quick updates to share before we get started. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for all PHCA members in attendance. As we begin today, all attendees should be in listen-only mode. Please feel free to submit any questions that you might have using the chat icon at the bottom of your screen, and we'll make sure to answer as many of those questions as possible at the end of today's presentation. And now I'll turn it over to our presenter.
Good morning, everyone. My name is Joshua Slen, and I have about 35 years of experience in the state and federal landscape in the healthcare space in particular. I worked in your neighboring state of Ohio for 10 years and in Vermont for 10 years. And I've been working for the last 7 years in the LTSS space and have done some work in Pennsylvania as well as in states around the country. This piece of work is a piece of work that we did with Advancing States, which is the home and community-based services leading national organization that all of the state aging directors belong to. And we did the work predominantly in 2023 across that entire calendar year. And I'm going to spend today talking for the first 10 minutes or so about what we did. And then I'm going to talk a little bit about what we found from the work that we did. And finally, I'm going to talk about what this means for you, what the next steps are, and how, if you want to, you can get involved to change our pathway for approving and getting accessible technology in the state ecosystem to support folks that have needs with long-term services and supports. So that's the basic outline. We're a small group today. Feel free to ping questions into the chat, and I will answer them as we go. Here we go. So first of all, Advancing States started in pre-COVID, actually, in defining what enabling technology is with a national state work group representative of states from across the country with all different delivery systems. And this is the technology definition for enabling tech. There's other technology definitions, as you know, assistive technology, supportive technology. There's a number of different technology definitions in the LTSS space. And unfortunately, today, we don't have a CMS definition, a Medicare or Medicaid definition that we can leverage, or that has been leveraged anyway, on a national basis to support, so that we'd all be using the same terminology for what's what. And one of the things that we hope will come of the work that we're doing is that we will get some standardized definitions and some changes to existing definitions so that states are operating on the same definitional basis. So these are the definitions. I'm not going to read as just a general comment the slides. You guys can read slides. I'll talk over the slides. Where we have a QR code, like in this case, there's one. You can get the technology paper if you don't have it already. And at the end of the paper, there'll be other collateral that you can pull down using those QR codes. Also, I didn't mention, and I'm happy to have communication asynchronously via email after this event. Kim and I spoke about that. I'm happy to have those communications come in today, tomorrow, or this time next year, whenever you have a question that you'd like to talk about in the enabling technology space. All right, so what did we do? We did survey structured interviews and affinity group meetings. Affinity group meetings are work group meetings that poll states that are interested in doing things together to do those things. And so we had a series of surveys that we did of states of innovators. So those are companies and founders starting with great new ideas in the technology space. Those innovators, there's thousands of them every year, as you can imagine, coming up with new ideas, finding funding, going out of business, and then some of them actually becoming fully fledged companies over a series of years or even decades. But we do find that states, although states are trying to bring those innovators and that information about what's happening in the innovation space to providers around their states, and in fact to the regulators as well, we find that it's not being done consistently, and the thousands of sort of amazing new things that are being designed and developed and sent out each year are just not getting out to everybody. So that information spread is a challenge. And so we also did a survey of health plans. So in particular, health plans that were managed long-term services and supports health plans that were managing long-term care in the states. So pretty a great many surveys went out in all of these spaces with a pretty high return rate, representing the vast majority of state enrollees and a massive spread of the different enabling tech companies that are out there designing things, and of the managed care plans. So large national plans in multiple states and smaller single state plans, all represented in the survey responses. And it was a hefty survey. It took about a half hour, 45 minutes to complete for a knowledgeable group of a few people at a managed care plan, or a couple of people who really knew their product at the innovator space. And for some states, they pulled together and spent multiple hours pulling folks from the disability side and the aging side, as well as from the Medicaid space, to answer all the questions. So really happy with the responses there. As part of this, we included enabling tech categories. You can see them here. If you look at different surveys or different things that were done, you'll see different categories that are utilized for technology equipment. And there's not sort of a one size fits all here, but we do, need to have a way to put things into categories. And you'll see these categories throughout the results that I'm going to talk about, and recommendations. Domains for action. This is a preview here of where we're headed as we get to the end of the presentation today. So we have a bunch of recommendations in the report. It's pretty robust with recommendations, and we're going to talk about next steps at the end. The next steps fall into these domains for action, and so there's things you can do with state laws and policies. And one of the things that we know is true is that in states that are tech first states, where on the disability side, technology has been a priority for a long time, and there's not a single definition of what it means to be a tech first state, but it does mean that in the disability space, that technology is something that has been a priority for a significant amount of time. And where we have states like Ohio that has been a tech first state for a long time on the disability side, and Tennessee is another example. And there's a number of these examples of state where state laws and policies on the DD side have been leaning into technology for a long time. We know that there's a lot of learning there that can be leveraged over into the aging space and can support our facilities and can support our home and community-based providers in improving technology understanding and appropriate utilization of that technology at the consumer level. So that's important. Federal agreements between the state is really powerful and important, including both for Medicaid providers, but also for Medicare providers and commercial providers. So this is not just a state policy, as I'm sure you know, doesn't just impact folks that are on a state program. It impacts with tax incentives and community design and education and training and regulatory requirements on all licensed facilities. It impacts everything. And those federal agreements are the seeds that start to allow states to or stop states. And, you know, as you plant a seed in one place, signing a federal agreement, it may prohibit you from planting something somewhere else. So financing is how states actually pay for and how we pay for long-term services and supports. I'm sure you're aware of the different funding streams to your individual institutions, and how that financing and the requirements around financing and how managed care plans in the next box price things impacts how you are able to provide and deliver to your folks that are living in the facilities. Access, really big issue around how do we get access? And by access, we mean throughout the entire study that we did, how we actually deliver access to the consumer. So this isn't about, I mean, it's important that institutions understand access and have access to technology, and training is a great space where we do that, as well as bringing with telehealth and remote monitoring efficiencies and access to consumers and to caregivers within facilities. But the access piece here is we're really focused on consumer access direct, which is the ultimate thing that we want to have happen no matter where we are in the system, is for consumers to understand and have access. Stakeholder engagement, critically important and often missed at the state level, almost never missed at the local level because we're all stakeholders and engaged locally. And so that's a significant domain for action. Quality measures, what we measure matters. And here's another space where, you know, what's being measured for quality, whether it's an MCO, demanding quality data so that they can get their star rating up for Medicare, or whether it's state or federal or other external entities pushing quality. Those measures are important. And then education and training. Okay. So here's what we found quickly, right? There's no single solution for all the domains and all the areas where we have new technologies coming out. But there's a bunch of things that we can do. These are pretty high level. We're going to get into more detail. Fear not, right? But the point here is that you have to engage, and you have to do it in a way that includes consumers, those tech vendors, and health plans. So what we see often is health plans talk to health plans, technology innovators talk to technology innovators, and consumers, by and large, talk to consumers and providers. They're providers providing their care. And so connecting these three groups is something that we don't do well nationally, or at the state level, or quite frankly, at the local level. And so doing that better is really important. And there's lots of ways to do that well. So we have to be transparent in policy, pricing, and process, federal, state, industry. That needs to happen. There's a bunch of specific recommendations on that in the back of the report. And facilitate cross-program alignment. So this is where we talk about at the end, right? Like pay attention, right? Definitions are important, and federal definitions are super important to help drive what actually gets approved, priced, and paid for. What are the approval pathways, measures of success? One thing states do terribly is agile, agile is a word I think we all know, right? Like designing those processes so that they can adapt is really important. And that's really at odds with tech vendors and how they design and move things forward. So our processes are not agile at the state level. Surprise, surprise. Work collaboratively nationally with federal partners. Equity is always important. And we need to measure performance. Okay. So here's high level state strategies, where are we headed? One is, let's learn across the board from our tech first state successes, not reinvent the wheel. Have an ongoing cross-programmatic enabling tech work group that includes providers, payers, consumers, as well as the regulatory folks at the state level, and keep that roadmap going. So there's a multi-sector plan on aging in Pennsylvania, right? That was just re-released, redone after, I don't know, a year and a half or so of work groups and things. You're probably well aware of it. It has 163 different tactics, they call them, but they're actions that are proposed in there. All of them impact you directly in one way or another, or indirectly in one way or another. And a couple dozen of those for sure impact you directly, speaking directly about what the state should do to support nursing facility staff and residents. And there's a significant opportunity there to use those tactics in your roadmap for where you can find support among the MCOs that are paying you, and among consumer groups that would be supportive of technology in the facilities. All right, national strategies. So here we're talking about what can we do at the national level to really drive changes here in access to enabling technology. One is that we need a maturity model that allows us to score states at where they are. How good are they doing across all of those domains? We need to develop technical assistance resources, which is a standard way to support states as they slowly improve all the access in those domains, and create a national learning community. So all of those things are powerful at the national level, maybe a little bit disconnected from a provider focus, but there's so much value. I just want to say, having done this for so many years, there's so much value. Nothing is more powerful at a national meeting, nothing, than having a consumer and a provider come and talk about why whatever idea, wacky idea, some we had at the national level or we had at the state regulatory level doesn't work. And even better, to point out not only why that something isn't working or won't work, but what a separate pathway is that you've seen work or be successful locally, because we have tons of successes in healthcare at the local level and very few that scale nationally effectively. And so finding those gems and helping them be successful is awesome. And it happens, I've seen it happen most when we have a provider and a consumer come together and talk about their perspectives on how it works. I mean, rapt attention from folks on the national stage when we can make that happen. All right, here's state respondents. These are the states that responded to the survey, and a few really big states, right? Which California, obviously, their response drives total number of humans, in California, New York, Texas, Florida. If you have those, you have, the massive number of folks responding. But we have a good spread, as you can see, from across the country in the state respondents, and from MLTSS and fee for service. So managed long-term services and supports, those health plans, and then the fee for service states. All right, so we're ready for results. So in this report, in this survey, we asked folks to talk about what have they implemented across these different technology categories in most recently, so in the last year. And this is the percent of respondents, so the percent of states that said they had implemented some new technology in each of these categories. You can see there's nothing above 30% here. In the beginning, I mentioned, right, that there's thousands of new ideas and thousands of new products every single year. Hundreds of those at a minimum are FDA approved, past the regulatory, have been priced, have been implemented somewhere, right? And many of those, or most of those, in more than one locality, state provider system. And yet, our ability from a regulatory perspective to know that those exist, to understand how they're different from our current definitions, like they don't fit in our current definitions, and to price those quickly so that they can be available to consumers is the gap, right? Our regulatory mechanisms for getting new information to consumers, you're going to see this played out in each one of these, which is it just points to, it's a call for action here, really points to the need to adjust our regulatory pricing, quality measures, all of those things to allow us to streamline and to actually be agile in getting what consumers want and need made available to them. And this, again, is not just Medicaid, right? Medicaid, Medicare, private pay. In each one of the domains, we have these same issues because the state can incentivize with tax credits, can inhibit with lack of speed to approve on the Medicaid front. Medicare, if it doesn't price something, we drive what we pay for things off of the Medicare price schedule. So if Medicare hasn't priced it, it becomes really hard to drive it out, even in the commercial space, at least not in a way that becomes well known to everyone. So there's a lot of work we can do to improve those government side processes that inhibit adoption. All right. We then asked states, okay, what do you expect to implement in the next 2 years? And again, none above 30. And you'll notice, with the exception of mobile applications, all of them are demonstrably, 10 percentage points lower than the prior, than what they did just recently. Some of this, we think, points to state folks who answer being very conservative, and that, in fact, we would expect them to implement at least at the same levels they have been in the past, not at lower levels, across these different types of equipment. We do see shifts, and you're going to see differences from what states are doing or expecting to do, and what innovators are doing and expecting to do, right? Like innovators are earlier in the timeline. They're inventing, producing, and getting approval for things. Until they get to getting approval for things, the states, until they actually file, the states may not have any idea that they're inventing those things today. And that's one of the time period disconnects that we see between the regulatory and the innovation space, which we would like to close, in large part with the stakeholder work and the adjustment to agile processes at the state level and the technical assistance at the national level. So watch for that. The MCOs are a different beast altogether, right? So they have contracts with the states or with Medicare, and they are following the service level agreements that they have with those organizations, and they have rate cells that they have to stay within, and so they're limited in different ways, and looking for return on investment from those innovations in order to push forward technology in different categories. So when we get to the MCOs and next and the innovators, watch for the difference here between what states have done and think is going to happen and what MCOs have done and think is going to happen and what innovators have done and think is going to happen. I talked about this already. 30% of survey respondents, fewer than that, have implemented or anticipate implementing. It's a big deal. That's why it's got its own slide. All right. So health plan implemented. Notice the health plan has implemented more things. So this is a, I guess if you're a managed care convert and you believe managed care is a good thing, this is evidence that, in fact, from an enabling technology access, that managed care plans are focused on delivering access to technology to their members in a way that state regulatory bodies aren't, meaning that they're doing more here. I would say they're still not doing enough. These numbers I'd like to see these numbers in the 70% and above across the board, meaning that we're implementing those new technologies on an ongoing and continuous basis, replacing old technologies and putting new remote monitoring and support systems for that, as an example, right? So when we talk about remote monitoring in the state, the I've fallen, the button that you press, I've fallen, I can't get up button, that is a remote monitoring system. But we have high-end millimeter detection that uses radar and can be combined in a remote technology today, which hasn't been implemented to replace those buttons, or to not replace them, but to be implemented alongside those in lots of places. Although skilled nursing facilities have done a lot more on the fall monitoring detection than other facilities for lots of reasons that you know. All right, next 2 years. Look here at the mobile apps, right? The amazing difference here between states and what health plans are planning to do in the next 2 years to support mobile apps among their members. Really a huge, huge change. And tech vendors. Notice here that neither of what I would point out here is that in communication systems, neither of the other two are anywhere near this number. And this shows what's coming. The other two are going to get on board with new communication systems because the tech vendors are focused there. 43% of the tech vendor respondents said communication systems they expect to do innovation in the next 2 years. That's a big deal. All right, so this is a little bit of a complicated chart. What we did here is we looked at what folks said they had done in the last 2 years and what they expect to do in the next 2 years. And we identified the change here. So for tech vendors, which is in the blue or slate blue, I'll use RPM, remote patient monitoring, the first block there as an example, right? They expect to do less RPM than they did. That doesn't mean they're doing none. It just means from a trend perspective, they expect to do less, enabling technology innovation in that space in the next 2 years than they did in the prior 2 years, right? So this is not a chart where the 27% versus 5% matters as much as directionally. Is it below the line or above the line? In other words, do you expect to do less than you did before or more than you did before? And what I would point out, one thing that I pointed out earlier that I would point out again here, is that states, by and large, have a negative view, right? Like at best, the state response is 0, like no change under predictive AI. But in every other one, the state responded, said, hey, we'll probably do less. I don't actually think that that's an accurate reflection of what will happen, but it's what they believe, because they don't, again, have the processes in place to have insight into what's being developed. And if we look at what is being developed or where health plans and tech vendors believe they're going to do more, right? Health plans say we're going to do more in mobile apps. That makes sense, right? Because innovators innovate new things and then MCOs start implementing them. And what is interesting is that MCOs are paying attention to that. Same thing in the RPM space, right? And states are unaware of it or not paying close attention to those trend line changes. I would argue and have argued and will continue to argue that paying attention to those trend line changes matter, and they matter to large provider systems and skilled nursing facilities and home and community-based spaces, because knowing what's coming can really help you in your next budget year about how you plan for efficiencies and access to new technologies that can help you, again, be more efficient in delivery and be more attuned to what consumers want and need. All right, so you can see these, the positive ones, predictive AI. We all, that's sort of a big national trend that I think everyone knows about. Adaptive equipment is an interesting one where tech vendors are actually doing a lot. There's all kinds of new robotic arms and technologies with lighter equipment that's being developed right now. And interestingly, right, this is not on the radar at all for states and MCOs, but it will be. Wait for 2 years, these numbers will change. All right, so what can we do about this? We need to adapt our state structures. We need to get closer to real-time alignment with the pace of technology advancement. And we need to think about those state domain areas. We need to watch really closely how we can improve what we do in those state domain areas. And I would say that skilled nursing facilities, assisted living facilities are a very, very important voice at the state level to move these domain levels in a consistent and appropriate direction. So your voice at the state level has a big impact on where we go. All right, I'm going to talk a little bit now about the national strategies and the state strategies in more detail. And these are all in the paper, and they come out of sort of all the detailed work that we did in the surveys, structured interviews, and state affinity groups. I didn't mention we did between 4 and 5 dozen structured interviews across states and MCOs and innovation organizations, and we did those after we did the surveys to follow up, and we interviewed a number, more than a dozen national experts in the enabling technology space, including national experts from university incubators that are incubating innovation, and LTSS leads at managed care plans. And then those affinity groups that we ran also included a mix of all of those organizations and a couple dozen different folks at each of the 3 affinity group meetings. So really, again, robust cross-sector and engagement in getting the outcomes, and then developing these national strategies and through those conversations and structured interviews. So here we go, national strategies. A maturity model I talked about before, that would allow us to go in and score a state. How mature are you? How agile are you? Are you delivering things? Do you have, like Pennsylvania does, have you updated your multi-sector plan on aging? And does it include enabling technology? Does it even include a definition that's commonly used across sectors on what enabling technology is, so that we get your state government regulators all acting together and doing things like using the same enabling technology definition to approve new technologies in state programs, and also to provide tax credits and other incentives for institutions that are want to purchase enabling technology and use it in those institutions, right? There's that alignment starts with definition, and I would say that that's a place for the community that you're part of to really lean in and get those set up correctly, so that you can benefit from those common definitions across state government. Let's get the technology roadmap and toolkit developed. Again, these types of the things I'm saying, if there's a national technology roadmap that CMS adopts, and a toolkit that comes out of that for states, then again, that technology definition becomes the same. Think of it as an innovator. If you're an innovator trying to have a new technology adopted, and there's different definitions, states aren't on the same place for pricing, then you can get it approved once, and you got to go get it approved 49 other times just to get the states all using your technology or making it available or on a tax credit form, wherever it might be where it would have an impact. National Learning Community, we talked about. Technical resources, we talked about. The Enabling Tech Fund, Opportunities Incubator, there's a number of those happening at the national level, and really building those out is a good thing to have happen. And there's only a couple though that are really focused on LTSS right now, and so having those grow would be a big deal, and getting folks like y'all connected to what those incubators are doing would again create some transparency and some agile information available to you in an agile way. And then we need those approval pathways, and that's something we're actively working on this fall, is to get those federal approval pathways move forward. So that's stuff like getting, there's tons of state requests actually for waiver authorities and approval of definitions that are languishing at CMS and need to be pushed forward. It's just not a blind spot, I don't think anymore, but I think getting that organization at the federal level to move those things is important. And this last one is not a last one, it's super important, which is at the local level, those myth-busting public awareness campaigns, things like, seniors don't use technology. Pshaw, we all know that's not true, but we don't advertise and push consumer-directed campaigns for new technologies to seniors as a sort of a really consistently and with the same language when we go from locality to locality. So, okay, let's talk about state strategies. I'm going to move through these relatively quickly, recognizing where we are in the time, and I want to make sure we get to next steps and what's happening later. So what's happening over the next 12 months or so. So budget lines make a big difference. Again, you can advocate for these at the state level. There should be enabling tech, an enabling technology budget line in the state, and it should be very clear in the budget that this isn't for enabling technology. That would support DD, so disability services, as well as Medicaid programs for non-disabled, and for individuals that are in aging space. We want to connect these policies across everything, and we want to develop guidelines for your payment models. So when there's value-based payment being pushed out, we want to again use the same technologies, pricing, all of those things. We want to track. We need tracking for this, for what technology is going out. Want to expand the tech first. We've talked about that. And there needs to be an ongoing aligned decision-making group at the state level. Stakeholder work has got to be constant and ongoing, not a one-off item. You need to work closely with your health plans. Might be obvious. One institution working closely with their health plan is great. A statewide organization like PHCA working with the health plans to make sure they understand the concerns, and hey, you guys could even adopt your own enabling technology definition as an organization, right? Like across all the skilled nursing facilities, assisted living facilities, and that would be a powerful place to start, as long as you're agile about it. So when the state adopts one with 3 different words in it, that you can get those aligned, those types of things that all of our organizations can work on. Multi-sector plan on aging, way to go. Pennsylvania has one. As I said, it's got 163 different tactics, and in Appendix B, take a look at those, highlight the ones that are skilled nursing facility related. There's a whole bunch of them, and even ones that aren't. So I'll tell you, one is support skilled nursing facility residents' access to recreation, therapy, socialization, and education opportunities that address loneliness in residential nursing facilities. There's a suicide one related to this as well. There's another one for assistive technology, again, a different technology definition that may or may not include enabling technology overtly, depending on the state that you're in. And important for us to get those single definitions lined up. Education and training, there's a ton of there's a whole section on education and training in your multi-sector plan on aging, and it's for caregivers, facility providers, and consumers, and that's exactly what we should be doing. Actually, the education recommendations are great in the multi-sector plan on aging. Rolling them out in a aligned fashion that doesn't overburden folks, and leveraging technology to allow people to do things like get on a webinar, but also to do a learn as you go and have a statewide way to do that, especially for safety education and tool-based supports, so that we adopt the same loneliness tools across, for example, and the same depression tools across, and not have a bunch of different ones with differential access depending on the population or program that people are in. You can read these. I'm not going to read the rest of those. So let's talk about next steps. Over the next year, Joshua, that's me, along with Mary Sowers and Martha Rorty at NASDS and Advancing States, respectively. NASDS is the National Association for State Developmental Disability Directors, right? So that's a really long acronym. Advancing States, which used to have a really long acronym, they were called NASUAD. But Advancing States is the HCBS, and NASDS is the Disability Directors at the federal level. And I'll be working with both of them, both of those organizations, to move forward these next steps over the next year. So the first three are next steps that we're working on actively now. The next three are questions I have for you. So we are working on the establishment of a work group, which will engage states from the disability space and the advancing space. So the commissioners or their designees from multiple states will be on that group, in addition to pulling in health plans and enabling tech innovators as we go. We'll be engaging with the federal partners to improve pathways for enabling technology, approvals, and payment. This is a CMS discussion that's going on right now. And we'll be planning for the next surveys. So my questions for you, I'd love to have you throw any answers in now, or send emails later, or give these questions to your peers, push them around. What would you like to see done to support you in the enabling technology space? How do your institutional needs vary across different institutions in Pennsylvania? And how would that impact the support that you need, or that different institutions need? So there's differences in size and geographic location and patient profile, all of that, payer profile. What survey questions would you like included in future surveys? The whole survey is in the back of the doc. If you are so inclined, or someone you know is a real detail person, ask them to take a look at the survey questions, and go ahead and ping me with questions you'd like to see. We'd love to make sure this is more helpful this next coming year than it was last year. Like, I want to make it better every year. And then, how can states support long-term care facilities in the enabling technology space? So as you think about the support that you get or don't get today from your state, all the different organizations that support what you do, or that regulate what you do, or tax what you do, or provide education or training and other things for what you do. How can states support you better? How can Pennsylvania support you better? Those are things that can really help the conversation amongst states and between states, and can help deliver what you need in the future. So with that, I'm gonna do one more thing, and then if you have questions, put them in. If you need to raise your hand, please do. I'm just going to run through some examples of tech companies that are in the space that are all startups. So this tech company, and I could use there's tons of tech companies, so I could give you all kinds of other tech companies in the space, but we just put a few on here. So Ground Game is a tech company that works with CBOs to complete assessments of social determinant of health needs for individuals, and provides that information to providers and to managed care organizations to help them make sure that folks get their assessed needs met. States are moving very aggressively, as you know, into the health-related social needs and social determinants of health space. And Ground Game is a company that is in this space, actually delivering with a full software approach and revenue sharing. So they actually pay the CBOs, which is a little different than Unite Us or a Find Help that is more like a 211 electronically. This company is actually about delivering the assessments, right? Like actually getting those assessments completed and delivering it back to the provider, in your case, back to the facilities in order to make sure that folks' needs that they assess our need using standardized assessments are in fact available in the room, in the facility, electronically, however they might be. So that's one interesting one. Vyar is an Israeli company that has that millimeter wave technology for detecting and monitoring falls. Instead of, as I said earlier, instead of the button, a lot of people take those off. The majority, not the majority, but the mode of falls, about 30 or 40% of falls happen in the bathroom, as you probably know. And video technology is invasive, but used still, if not in the bathroom. And if when you go to to take a shower, you take off your lanyard, then you fall. That's a challenge, but this technology is a newer technology that can actually tell you if someone fell, and even cooler than that, it can tell you how fast someone fell. So they have an algorithm, and they can show, they can see it's dots. It's not like the picture of the person, it's just like dots, but they can see how fast the person fell, how fast they're moving, if they slow up or speed down over time. And so if they're slowing down over time, not even having a fall, they can identify things like, hi, there's something going on. They've slowed down quite a bit. They haven't gone to the bathroom in 3 days. Right, like they can tell you that, all those types of things, not just falls, which is, I think it's super helpful, and another point of information. In an institution, I know that they're deployed across hundreds of institutions, skilled nursing facilities today, but not everywhere. And it's a great advance in technology. And here's a loneliness vendor. There's a number of platform vendors that are delivering loneliness solutions. This is unique in the fact that they are producing bespoke, so for individual institutions, programs that fit into their needs, as opposed to programs that are just generic for everybody. And so a little bit different bespoke approach, and not the first thing for an institution, certainly powerful for folks that are living in rural areas and isolated, but also I think helpful for folks like event-dependent individuals and others who can't get into the main room. They could participate with the folks in the main room via this type of bespoke creation of content. So all of these are examples, I think, have some resonance in the senior living space broadly, in the assisted living space and senior community spaces for sure, and in the skilled nursing facility spaces. So with that, I am at an end of my talking, which is good because my throat's starting to hurt. And that's my business card. On the left, my HST info, so for my company's information. Again, my email is here. I am happy to answer questions from you or your peers. And with that, I'm going to say thank you for participating. I don't see any questions in the chat, Kim, at this point.
I
So
don't either.
if there are none, I'm all done.
All right, thanks so much. Thanks for this valuable information. And as a reminder, if you do happen to have a question after today's session, please reach out to myself or Joshua. We're happy to answer those questions. And we will give everyone back 10 minutes of their day. Thanks, guys.
Happy Monday, everyone.